Good evening to everyone. I'm Corey McCray, Senator for the 45th Legislative District, just representing parts of East and Northeast Baltimore. I'm had the proud, distinct honor of being able to chair our Baltimore City Senate delegation. And just want to say thank you all for joining us tonight at our weekly delegation virtual grassroots briefing. Before we get started, I would just like to take this time out to recognize my colleagues who are with us this evening. At this moment, I'm going to go in numerical order by district. We have Senator Jill Carter, who represents the 41st Legislative District. We're also joined by Senator Mary Washington, who represents the 43rd Legislative District. And momentarily, we will be joined by Senator Antonio Hayes and Senator Bill Ferguson will acknowledge presences inside of this virtual meeting. But we have, over the last 2 months, had the opportunity to hear how COVID-19, the pandemic, has impacted our small businesses, our public schools, housing security, our colleges, universities, as Maryland and the nation continue to chart a path to reopening. We thought it would be appropriate to actually hear about the status of COVID-19 vaccine distribution from leading health professionals. I'm going to start by just recognizing our first speaker, Dr. Mohan Santha, President and CEO of the University of Maryland Medical System. Has to depart shortly before the other speakers, so we will hear from him first. Just a quick, before I turn the floor over to him, Dr. Mohan Santha was selected as President and CEO of the University of Maryland Medical System in November 2019. Prior to this assignment, he was the President and CEO of the University of Maryland Medical Center, one of America's oldest academic medical centers. Dr. Santha has a deep commitment to our great state of Maryland, having worked to rebuild trust and alignment between medical staff, employees, and the administration during his time as CEO of the University of Maryland St. Joseph Medical Center. Dr. Santha has spent his entire career with UMMS, starting as a resident with the Department of Radiation Oncology 30 years ago. We are so glad to have him with us this evening. Dr. Santha, the floor is yours at this moment.
Thank you, Senator, and thank you to the entire city delegation for giving us a few minutes to talk to you today, this evening about what I hope when my comments are over, my hope is that you'll agree that through this pandemic, I think both Maryland and Hopkins have been purposeful in trying to demonstrate our understanding of the unique responsibilities we have as anchor institutions in our communities. And when you think back to now, over a year ago, and when the pandemic began, I think there are a number of ways that very tangibly, I think our organization has tried to demonstrate what it means to be an anchor. And so if you think about, at least in my mind, I think about COVID and I think about the unique challenges, and they really fall into the buckets in my mind of obviously care delivery, as we care for disproportionate numbers of COVID patients, both from within our city, around the state, and the region. There's also the need around education, as we continually try to demonstrate the resource that we are as a healthcare organization committed to the highest ideals of academic medicine. There's also the recognition as anchors of our responsibilities in owning the social determinants of health and how we might invest in and deliver resources to our community in some unique ways. And with, thankfully, the point that we are in today, the ability to talk about the roles we play in the global vaccination effort to help get our communities, our city, our state, our region beyond the challenges of this current crisis. From the beginning, when I think about who we are, the care delivery we have now, as I think Kevin would attest, Maryland and Hopkins have cared for a disproportionate number of COVID patients. From the beginning, we recognize the need to address the needs and demands of the realities of our city in a different way than perhaps other regions of the state. And so forming the P3 partnership with the city of Baltimore, with Johns Hopkins, Maryland, and Care First, P3 was stood up to try and recognize whether it was testing, whether it was education, whether it was the unique needs of our most vulnerable members of our communities, the efforts around standing up a response with the Lord Baltimore Hotel Partnership as an example. We've tried to, again, be viewed as a differential resource here in the city. We never forget that our single greatest asset as an organization is our workforce. For our system, that is, we are now over 28,000 strong across the state of Maryland, and we've tried to, again, be purposeful at the way we've leaned in to support our workforce through this crisis. And whether it's been the approach to pay practices, the approach to PPE resources, the very purposeful decision through the volatility of financial realities to not engage in any layoffs or furloughs and to support our workforce through this is, again, another example, I think, of how we've tried to demonstrate our understanding of our responsibilities. So that takes us to the conversation of vaccinations. And again, like the rest of the nation, the healthcare community had the responsibility of being the first out of the gate to vaccinate our workforce. Very purposefully, that was a national strategy. And I tell you that because I think, and Kevin will probably attest to this as well, we have learned lessons as we've vaccinated our workforce and offered vaccines to our workforce that can serve us well as we focus on the efforts of vaccinating our communities. And I'm going to come back to that point, but I mention it because you have to remember our healthcare workforce in this nation are probably for the foreseeable future, the one true denominator that we will have in understanding the issues associated with vaccinations. For our health system now, across the entire health system, at our member hospitals, we've now vaccinated, we've actually delivered over 100,000 vaccines. When you add the state mass vaccination solutions where we, the medical system, are partners, that number climbs to nearly 200,000. And so again, when you think about what we've set up, we have tried to deliver to, in partnership with the state, solutions that can address the approach to vaccinating large swaths of our community. From the beginning, as we do it in our member organizations, so our hospitals, and now as we focus our efforts on the mass vaccination solutions, we've tried to, again, address vaccination with a purposeful approach around equitable access. And I'm going to talk about some of the work that we've tried to do to address that. When we think about the issues of equitable access, we think about the issues of transportation. We think about the issues of digital divide. We think about the issues of registration and scheduling and communications. And we think about the issues of hesitancy. When I talk about the hesitancy, I'll be honest with you, and many who know me know, I don't even like the word because I don't think it actually delivers true perspective, because it is easy to think of hesitancy and think that there are people who are just saying no. And again, let's go to our workforce. And I think we both have understood that there are very few members of our workforce who said no, 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 and never to no, right? There are some who have said not yet. There are some who have questions, and that there are journeys to decision-making that have different pace to them, that And when we think about our approach to addressing hesitancy, we're trying to be mindful of. So when we provided to the state, in partnership with the state, a plan that could consider standing up M&T, very purposefully, we asked the state to consider with Hopkins an approach that would allow us to utilize the resources at the convention center as M&T got turned on as a state resource, to very specifically turn the convention center into a resource that would disproportionately be a city resource. And so thankfully, they agreed to that approach. And so just to give you some numbers, today, this week, the state has allocated 7,000 vaccines this week to the convention center. We have the ability to do slightly over 1,000 to 1,500 vaccines a day at the field hospital. Remembering the field hospital is delivering acute care, is delivering testing, is delivering antibody therapy, and is now a vaccination solution. At M&T, it's about, we're now at 4,000 a day of delivered vaccines. So this week, M&T has 28,000 vaccines allocated to the M&T effort. I'm giving you pure numbers. Given the focus this week, up to 80% of the slots at the convention center are able to be earmarked for city residents. And I'm gonna, again, walk you through what that means. And so the only reason, or the major reason that it's not even higher than that is, again, through the state registration process, we realize there are already people in the queue who are not city residents who have already defined appointments. And that's a reality. But the way we're going about increasing registration and scheduling in our communities, we believe are showing the impact that you'll see in a minute. So we've now hired 20 community health workers to be from our communities, for our communities in West Baltimore, to very purposefully stand up community-based both registration and scheduling solutions. As of today, we're standing in 15th of March, we're standing up those registration centers at Coppin State, at Mondawmin Mall, and at New Psalmist in West Baltimore. And those community health workers will be manning phone banks, on-site registration and scheduling, and to be able to allow our communities to actually schedule appointments in their community as opposed to using just the internet-based solutions that the state has. From a transportation standpoint, we are using our medical systems lift contract to provide free transportation for our community members who are in need of transportation to get back and forth from the convention center. And we now recently at convention center gone to block scheduling for churches in the community, where the churches will actually be able to provide transportation solutions in bigger numbers by getting them block scheduling at the convention center. So these are all examples of efforts that I think are our evolution of what we are trying to do to address the issue. I want to touch on a couple other things, but when it comes to the issue of hesitancy, we again are purposeful in a decision that we've approached in terms of not starting with the use of J&J in vaccinating members of our community out of the gate with J&J in our Black and brown communities. And that's a purposeful approach, not because, I want to be clear, not because medically we have any concerns about any difference in efficacy. And it's really important you hear me say that. From a healthcare perspective, we have equipoise on all three vaccination options, but recognizing that there is initially some question or concern about the J&J vaccines in some of our communities, we've made that purposeful decision to not start there. I will tell you at M&T, where we got J&J, M&T, it was utilized, and it was utilized with great success. And the more success that that has, I think that will open up our opportunities. But again, that's a purposeful decision we've made to try and address and be to demonstrate that we hear the concerns of our communities. The last thing I will leave you with is our mobile vaccination effort, which is, again, starting the end of this month, we are, again, going to be standing up mobile solutions. Like, again, our partners at Hopkins have done this, and I'm sure he'll talk about that. Our approach will be to run mobile vaccination from the end of March through July with our workforce. Again, we'll be running those 3 days a week. We're starting on the 3 zip codes of 151617 that, again, partnering with the health department. They were the hardest hit COVID disease burden zip code. So that's where we're starting. We'll gain input from city officials, city health officer, and other partners as we make our decisions about where we'll be targeting to start mobile vax. So I'll stop there, keep going, but I want to leave time for questions.
Now, I appreciate you, Dr. Sumter. And just for those that's listening, just wanted to make sure that Dr. Sumter has a meeting to get through, an executive board meeting to get to. That's why we let him kind of go from the other 3. At this moment, I wanted to see if there are any questions of my colleagues for Dr. Sumter. Senator Washington.
Thank you, Chairman, and thank you, Dr. Sumter. I wish you were leading our statewide vaccine effort. I guess I want to have some clarification around who, maybe, and then also for the audience, because this is an opportunity to educate people. Who are the member institutions? So you mentioned Hopkins. Yeah. So could you just mention?
So it depends on who you're talking about. So
right.
When I talked about P3. The partnerships of P3 are Johns Hopkins, University of Maryland Medical System, Care First, and the City of Baltimore. Those are the members of P3.
Okay.
When you hear me talk about member organizations, I'm referencing the hospitals that make up the medical system, which obviously are a geography across the state of Maryland.
Right, and so you're talking about the hospitals, but these are the University of Maryland hospital system, correct? Okay, all right. I just wanted to be clarifying that, because I had some questions about the vaccine distribution, and I'm assuming you can't answer anything about how Hopkins distributes its vaccines. I'm assuming you can't do that, or can you?
No, but my friend Kevin Sowers.
Kevin,
I'm sure I'm gonna be able to do
okay, so I was just wondering, you mentioned that we had 28,000 workers. What proportion of those workers are that are being vaccinated are teleworking versus the ones that are, mopping the floors and changing the bedpans and doing that? Is there
so across our organization at this point, everybody who has wanted a vaccine of our workforce has been offered a vaccine. The vast majority of our workforce, as a consequence of being healthcare in the industry of healthcare, are healthcare workers who are still physically in the hospitals delivering care or providing support for care delivery. So for us, it's a small percentage of folks who are not hospital-based of the folks but everybody, I want to be clear, everybody's been offered vaccine in our workforce.
And I guess finally, I know there's other questions, but I just really want to appreciate you standing up and resisting this sort of farce about African Americans and people of color having a hesitancy as an excuse for the disparities in the distribution. I mean, we're catching it this week, but we're seeing the majority of people that were at the mass vac sites were not from Prince George's. The majority who were at the mass vac sites of Baltimore City were not from Baltimore City. And every time we asked that, for at least the first 6 weeks, it was blamed on some kind of cultural hesitancy. And so I really appreciate you resisting that. And also, interestingly, you mentioned the Johnson & Johnson. I spoke to a neighbor this weekend where he gave that very reason that when did Johnson & Johnson start making vaccines? Don't they do baby oil? And I was like, wow, okay. So it seems like some public service announcements or what are that, as we need to use that vaccine increasingly, that just educating people about that they've been in the pharmaceutical business for quite a while. And so, but I absolutely appreciate you recognizing that. And please continue to press our acting secretary and our state responders to really have that level of competency when they're picking solutions. So thank you so much for what you're doing. I guess that's sort of a, isn't it so? Chairman.
Thank you, Senator Washington. Before we jump to Senator Carter, I just want to I see the other folks are itching to get in on this conversation. So I'm going to get Senator Carter, and then we're moving right directly into our other three to get in this conversation. Senator Carter.
Thanks, Mr. Chair. And Senator Washington actually expressed my one area of gratitude around dispelling the myth of hesitancy. So I appreciate that. I also want to say, Dr. Sinta, I got to give you a shout out for all of your work around the food distribution during the course of the pandemic. It was really incredible efforts. And, every time, aside from what you do on your own, every time I reached out for anything that was even unorthodox or out of the general mode of what you were distributing, always receptive, always was able to serve people wherever they needed it. Second, around the public service, around the community engagement, you mentioned Coppin, Mondawmin, and New Salmon being service centers, call centers. Can you shed light on the actual efforts around educating people, community engagement, and whether or not those will be also sites for distributing the vaccine at some point? Like, how are people to know what to do, where to go at this point?
Right, so those are sites that we try to set up as location sites for registration and scheduling. They're not at this point vaccination sites as we look at the distributed model for vaccinations in the community as of yet. But they were identified based on conversations with leaders in our case in West Baltimore to say, where are the areas that we think might have the potential for highest opportunity for people to more easily get to, who are struggling with the issue of whether it's the digital divide or wanting to engage in conversations before they decide. So they really are set up not to be vaccination centers, but to be scheduling centers. But the difference is it's not just registration. These are places that have the technology to literally schedule people while they're in front of them or on the phone. So you don't have to get on the internet. You can, it's a phone number, and we're trying to use our community-based relationships to communicate about these centers. But literally today's day one. So we have work to do there, but I think we're excited about what this could mean and actually helping decrease the burden on the state's resource infrastructure so that people feel a more direct connection so that they won't hear, well, I've been registered, but I don't have an appointment. This is to say you can register and get an appointment that very same phone call or very same interaction.
Thank you, Senator Carter. At this time, I'm going to get the other three in the conversation. I'm going to very quickly read some very short bios, but I will introduce all three. We will hear from the senators to ask questions, and that we're going to hear next from Dr. Jillian Chan, Dr. Letitia DeRozer, and Dr. Kevin Sowers. Dr. Jillian Chan currently serves as acting deputy secretary for public health services at the Maryland Department of Health. Dr. Chan's passion for public health began during an internship from the Centers for Disease Control and Prevention, the CDC. After medical school, she moved to Maryland to complete her residency at Johns Hopkins. Upon the completion of her studies, she's worked at the Anne Arundel County Department of Health, eventually being named health officer. To her current role, she served as Assistant Secretary of Health. Dr. Chan, thank you for joining us. And we will also have Dr. Letitia DeRaza, was appointed Commissioner of Health in March 2019. A Hopkins-trained pediatrician, she believes that equitable care is a basic right for all, and she tirelessly advocates for programs that support the overall health and well-being of Baltimoreans. Her innovation in public health has assisted our city greatly as we manage the COVID-19 pandemic. Prior to joining the city of Baltimore, Dr. DeRaza worked as a health innovation officer with Fearless Solutions, a Baltimore-based digital services firm. Her connection to Baltimore, whether being trained at Hopkins or once serving as a medical director with the Baltimore Medical System, informs her work today as Commissioner of Health. Dr. DeRaza, it's great to have you with us this evening. Last but not least, we have Dr. Sowers, is President of Johns Hopkins Health System and Executive Vice President of Johns Hopkins Medicine. He is the second person to hold these dual roles, overseeing the system's 6 hospitals. Mr. Sowers came to Johns Hopkins after 32 years with Duke University Health System, the final 8 as president and CEO of Duke University Hospital. A registered nurse, he is an American Academy of Nursing Fellow and has published extensively on issues such as organizational change in cancer care. Mr. Kevin Sowers, we are so glad to also have you with us. We're going to start in that order, and Dr. Chan, you're up.
Great. Thank you so much, Chair McCray, and to all of the senators, and also to my distinguished colleagues who are joining me on the agenda today. I wanted to share some brief slides, and some of you may have seen some elements of it, but wanted to update and focus on vaccinations, because that's certainly top of mind. But as Dr. Santha alluded to, we continue all of our other efforts regarding testing and contact tracing and sequencing and a lot of other work in which we're also still partnering with the 2 academic institutions, both at University of Maryland and at Hopkins. And so very much appreciate the partnership. Next slide. So as of today, Maryland has vaccinated or administered 1.9 million doses of vaccine. And so if you think back, we started in December, mid-December, with some initial doses being sent to us, and we've really ramped up a tremendous amount of effort over the last few months. And that is in no small part to the individuals who are on the phone and yourselves in the partnership. We anticipate that we'll actually exceed 2 million doses before the end of this week even. And at this point, over 21% of our population has received at least 1 dose. We continue to be able to expand the number of daily doses administered at a number of different sites. I know we get a lot of discussion about our mass vaccination sites, but there's so many other locations also vaccinating around the state. Next slide, please. So right now, we believe, because we've vaccinated fully vaccinated close to 1 million people, that about 50% of the current eligible population, which is estimated to be about a little over 2 million people in phase 1 alone, that about 50% have received at least 1 vaccine or fully vaccinated. 100% of our first doses have been administered. And as we get more vaccine every week to all of our partners, we are utilizing all of those doses. Just recently, we actually did set even a record of over 56,000 vaccinations being administered across the state. And right now we have 418 vaccination sites across the state, and those continue to grow as we're adding more providers. And I'll talk a little bit more about that in a moment. And then we had stood up a call center not too long ago, and we have to date fielded about 820,000 calls from the call center, and we continue to use that call center working with our mass vaccination sites and to help people get appointments. We have scheduled so far 35,000 appointments. Next slide. I know that people continue to have questions about the allocation process. And so I wanted to just touch on that. Over the course of even the last few weeks, we are seeing an increase in the number of vaccines that we're getting each week with this new administration. And so it's now averaging about 16 to 17,000 doses a day. That is what we're being allocated. And that actually, in the last couple of weeks, does not include the close to 50,000 of the Johnson & Johnson vaccine that has been allocated. They did sort of push out all of the Johnson & Johnson vaccine that they had at the federal level right after the vaccine was approved by the FDA, and more will be coming. Our approach is that about 30% of the total number of doses goes to local health departments, and then we prorate it based on the population in each jurisdiction. We have been dedicating a significant portion of doses to mass vaccination sites, so about another 30%, and we will be expanding so that we have at least one large mass vaccination site in all of our states' regions. And we know that the M&T site, as well as the Baltimore Convention Center site, really couldn't have been done without the strong partnership with both Dr. Santha and Dr. Sowers, who really have leaned in and taken on a lot of the oversight of the clinical aspects of it. And I will say here that the Baltimore Convention Center really is a unique aspect of our COVID response, in which it really has taken on such a centralized portion of the work that we're doing, in that it is so multifaceted, not only about vaccinations, but testing and clinical care, as well as monoclonal antibodies. So really focused on the work there. Last, when we look at the rest of the doses, those are allocated to other providers. So hospitals are included, but also pharmacies. We have allocated some to FQHCs. Those are also, more FQHCs will be getting a direct federal allocation beginning this week. And also, beginning this week, we are going to be expanding to more primary care offices, particularly those with a large patient population who are Medicare. And there's a number of them who are in the city that we're starting out with as well, who have individuals who are not only older, but may have some comorbid conditions. And so we are starting out with 17 primary care offices this week as an initial pilot, so that we can begin to get more people vaccinated in multiple different locations. So next slide. So from this chart, and this is available on our website as well, you can see from the beginning where all the doses are going by jurisdiction. And I will say that when you include the initial weeks, a lot of those are in the city, probably because the city has many hospitals, and the first few weeks of allocation were directed towards hospitals to get healthcare workers vaccinated. However, the city does continue to get allocation and to the variety of partners. And I know that the city has been partnering with many of the hospitals around the city to be able to target vaccine to smaller communities and to provide vaccine access in smaller venues with community organizations and others. Next slide, please. Which is, I think, an important part of the conversation when we look at vaccine allocation that and vaccine distribution, is that, when we look at who is getting the vaccine from the provider standpoint, it's also about how they can get vaccines not only into just any arms, but also the ones who are at the highest risk. And so that's where the work of the Equity Task Force has really brought additional focus and attention to this work. And General Burkhead and her team, along with members of MDH's team, including Dr. Mark Martin, who is part of our Minority Health and Health Disparities, who is also on the call tonight with us, have really been leaning in and having multiple conversations with our community partners, identifying areas of need so that we can direct vaccine. to those locations. And that has started, over a month ago in partnership with many of the same partners that we've mentioned already, both with Hopkins and with University of Maryland, but also with some of our pharmacy partners in Rite Aid and Giant and others around the state. Next slide, please. So I think some of these were mentioned, and Dr. Santha also mentioned other efforts that are happening around the city. And so there's really a lot of activity, knowing that we're building in layers of access, because mass vaccination sites are visible and we can see them, and we can get a lot of people through and get vaccinated, which is very important because we want to get as many people as we can vaccinated as possible. But we also know, for all the reasons that Dr. Santha mentioned, that not everyone will be able to get there, or it's not the site for them. And so I think that the term hesitancy, I would agree with Dr. Santha, really has many, many layers and is a lot more complex. And to distill it down to a single word, I think really belies the complexity of really getting down and having individualized conversations with people, where, even among the same community or in the same household, even the questions or concerns, or, even the ability to access internet and be able, I know my parents can't use their smartphone. I can barely do my own phone, but, there's variability across even in the same household or within a community. So that's why we're really carefully trying to build in multiple layers of vaccine access so that people, no matter where they are, they can go potentially to their neighborhood pharmacy, to their, to a mass vaccination site, or to their church even, to get a vaccine where they have, where they know where to park, where they know how to get there. Those, I think, are important aspects to it, that we have to consider, that there are just different layers that we're trying to build in. So you can see that we've done a number of partnerships in the city alone, and more are being planned as we speak. We have reached out and worked with Rite Aid to partner to actually access and help to vaccinate both the aging and the disabled populations that are in some of our smaller group homes that might not, again, be able to access some of our larger vaccination clinics. And then in terms of outreach to communities, we have work now underway to provide information and education through some of our partners at the local level, through salons and barbershops, and importantly, through our churches and other community organization partners. So next slide. So we've already talked a lot about the regional mass vaccination sites, and in Baltimore City, there's the Baltimore Convention Center. And as was announced just earlier today, we will be reserving about 2,100 doses at the M&T site that will be reserved for Baltimore City residents. And so we'll be working closely with our partners, with the local health department, Dr. Jaraza's team, to identify individuals to be able to get them appointments and get them to M&T Stadium site. So we appreciate the partnership of everyone on this call to make that happen. Next slide, please. And I also wanted to mention, if you weren't aware, that over the weekend, the state launched a pre-registration system for our mass vaccination sites at the state level. So this includes M&T Stadium. And so once people actually register, when an appointment is made available, they will be contacted so that an appointment can be made at a time and a date that is convenient to them. So that registration site just launched. Next slide. And I believe that about 35,000 people have already pre-registered. And it's not just for the M&T Stadium, but we have other locations such as Six Flags, Regency Stadium, and there will be 2 others launched in about the next week or so, both in Western Maryland as well as on the Eastern Shore. People can go to our website at covidvax.maryland.gov, or you can call, people can call our phone line at 1-855-MD-GO-VAX to actually ask to be pre-registered for one of the mass vaccination sites. So people who, we talk about the digital divide. If you aren't able to access internet, there is a phone number for people to call.
Dr. Chan, if we could start
Yep.
closing so I can get everyone else in.
Absolutely. Last slide, if you just could. So the last piece is that, President Biden in comments earlier this week indicated that he anticipates that and that states should prepare to open up vaccines for everyone and make it accessible to everyone, and everyone will be eligible. And I think that what we've been building all along since the beginning of our vaccination efforts is to exactly do that, is build up a system that has multiple access points that people can receive vaccine. And so we will be ready when that time comes. And so we are prepared for that. And so there will be more to come in the weeks ahead, and we look forward to that time. So I will stop there, Chair, and pass it to you.
Thank you, Dr. Chan. We're going to hold questions till we get everybody in. Dr. Daraza. And you've been made.
Perfect.
Yes, ma'am.
Wonderful. Thank you. Thank you, Chair McCray, and thank you to other members of the Senate delegation here in the city. And thank you to my esteemed panelists who I partner with often. Really great to share this time with you all. So just starting with the data and looking at where we are as a city. So to date, we've had a little over 93,000 individuals in Baltimore City vaccinated, which accounts for almost 16% of our population. You can find this information on our dashboard. And we are tracking closely how vaccination rates compare to new case rates. So there is also a map on this same dashboard where you can drill down. On this map, the purple circles represent the numbers of individuals in a particular zip code that have been vaccinated, while the darker areas of the map represent the case rates per that particular zip code. Looking more closely at comparisons between Black and white residents, we see that about 9.3% of all Black city residents have been vaccinated compared to 21.6% of white city residents. This can also be found in that same dashboard, and it breaks down the percentage of individuals that were vaccinated here in Baltimore City that were residents compared to other jurisdictions. And you can see that here in the city, a little under 40% of all those that have received vaccination through some clinical partner here in the city are actually city residents. So all of this information is important as we think about our approach. So we early on set a vision for equitable vaccination because we wanted to achieve population immunity, but we also wanted to do it in a way that's equitable, creating access to communities that we know have been hardest hit. We know that we do this work not by ourselves, but alongside residents, alongside the state, alongside community-based organizations, our healthcare partners, many of whom are represented on this call, and businesses here in the city. So we set goals underneath that broader vision of having at least 80% of the city population being vaccinated, again, with a particular focus on accessibility and equitability. We also focus on addressing COVID-19 vaccine deliberation. And I, like Dr. Suntha, agree. We know that there are individuals who are taking in the information before they make a decision. They're seeing how a friend or a colleague responds to the vaccine. So it's our job as the local health department to provide the information necessary with an emphasis on populations that have been devastated by this disease so that people can make an informed decision. So we are really thinking about this in two ways. There's this volume approach, which focuses on large vaccination sites or your mass vaccination sites, and you can get a large number of people through. What we know, though, sometimes about those mass vaccination sites is they're fast, but they aren't always fair. So we know that we had to also take a focused approach. So having multiple smaller locations and multiple access points so that we can reach more individuals. This will include your primary care clinic. This will include your federally qualified health center, which often acts as that safety net healthcare provider. This includes your pharmacy, but a key part of our strategy has also been deployment of mobile vaccination teams to bring vaccine to individuals in highest need. So looking again at that three-tiered approach, at the bottom of the pyramid, you've got your mass vaccination sites, and much of the general population will utilize this resource. This is run through, in our instance, we have a pod at BCCC. We know our hospital partners are also capable of performing pods. We have the state's mass vaccination sites. And then in the middle of that pyramid, you've got your standard healthcare model. So, many studies have shown, Kaiser Family Foundation released a study that showed the majority of people actually would want to go to their primary care provider. And we know there's the advantage of going to someone trusted in your neighborhood that you can have a conversation with about the vaccine. And then lastly, at the very top of that pyramid is the mobile vaccination teams. So this has been done, all of this work has been done in partnership with other healthcare providers, who I'll name in a few slides. But this is really us going into the community, taking the vaccine to where it's needed most, providing pre-registration there for the community, and then performing the vaccinations on site. So to date, we have established a pre-registration line to support our older adults, and have to date have over 20,000 older adults on that line. We have dedicated special population leads. So focusing on our African-American communities, our Latinx communities, our immigrant communities, those with intellectual disabilities and developmental disabilities, our older adults, and our Jewish communities, making sure that, again, we are focused on those communities that are high need. And we're also focusing our education around those communities. We have to date had closed pods that include our educators, our first responders, continuity of government here in the city, as well as older adults. We've been fortunate to be able to partner with multiple hospitals across the city. Mercy has been a hospital that supported vaccination of older adults from that pre-registration list. Our city educators, our daycare providers, Hopkins Health System has supported city educators. MedStar also supporting city educators, older adults, and daycare providers, and then University of Maryland Medical System, who will be working with, again, on their mobile vaccination efforts, as well as University of Maryland Baltimore to support older adults. We've been deploying our mobile vaccination response teams now for multiple weeks, and we're now up to about 6 to 8 teams going out per week. Our clinical partners include Hopkins, Hopkins School of Nursing, Safeway, and MedStar. Again, Dr. Suntha, and I know Kevin will talk about the partnership to support state vaccination sites, specifically with the focus on city residents and getting vaccines to those. We have additionally reallocated some of our vaccines to our federally qualified health centers. The next part of our approach really includes communication. So ensuring that there is appropriate communication about the vaccine so that we can support vaccine deliberation. So at the very bottom, that general approach, again, advertising where and how to get a vaccine, talking about the facts of the vaccine, using our social media to put a lot of information out there. We've done flyers. We're getting support from the Mayor's Office of Neighborhoods to do canvassing around the city. There's also the neighborhood-based approach. So working with our primary care providers to make sure they're comfortable in providing education to their patients about the vaccine. And then again, at the very top is that special populations mobilization approach. So we've held multiple listening sessions so that we can get feedback on what messaging is most important. Also participating in multiple faith-based outreach, as well as multiple town halls across the city. So again, some of the tactics include establishing an external partners task force, which we established back in January, having a community engagement subcommittee that focuses on our communication efforts and help us to tailor our message so that it's specific to the population that we're trying to reach. We've been partnering with the International Vaccine Access Center at Hopkins, Morgan State, and MICA to hold cross-city listening and education sessions with our special populations. We're also ensuring that our staff is adequately and culturally competently trained to be able to address concerns that may arise from city residents. Again, developing and tweaking messaging so that it is really targeted towards communities in highest need has been a large part of our strategy from day one. And we're in the process of hiring vaccine ambassadors that will go out into the community and support the special populations. So very quickly, accomplishments to date, we've held 26 mobile vaccination clinics since our launch on January 29th. Over 2,200 individuals have been vaccinated with at least one dose. Where we have the data, about 80% of those vaccinated are African American. Also, where we have the data on those mobile teams, about 85% of those vaccinated are over 60. We've pre-registered over 20,000 older adults using our MAP call center. We've provided at our vaccine pod 17,000 doses to date, and so far have held 6 COVAX listening sessions with many more to come, again, focused on our special populations. So very quickly, resources. We have older adults who can pre-register. They can either call this number 410-396-2273, or if they have access to the internet or support, they can use this link, bit.ly/BeMoreCovax65. And all of this data can be found on our website at coronavirus.baltimorecity.gov.
Dr. DeRosa, you were good, and you left us 2 minutes for
I was trying to go quick.
No problem at all. President Sowers, please, last but not least.
Thank you so much, Senator, and thank you all for having me tonight. And I want to thank the delegation for the challenging issues that they've had to deal with because of this pandemic. But I also want to recognize the incredible partnership that Mohan and I have appreciated with the mayor, Mayor Scott, and also Dr. DeRosa. The partnership with Dr. DeRosa has been incredible, and we're very lucky to have her as our health department director for the city of Baltimore. She's just been an incredible resource. You know, Mohan spoke to the disproportionate share of COVID patients that both and Hopkins have taken care of. Since the beginning of the pandemic, Hopkins has now cared for over 6,400 inpatient COVID patients. And we have seen during that time period 640 deaths. We are now being benchmarked across the nation against other academic medical centers. And I'm pleased to say that Hopkins is in the top 3 in terms of overall survival from COVID. And we've learned a lot from the first surge and how to treat people going into the second surge. One of the things I want to highlight for everyone is today, Johns Hopkins Health System sits with 140 patients with COVID. One of the things, though, that we're seeing is about on any given day, about 40 of those patients are no longer infectious, but they remain hospitalized because of the clinical sequelae that comes from having COVID. So today we have patients who are on long-term ventilation that can't come off ventilators because they're no longer infectious, but because of the damage that's been done to their lungs. We have cognitive impairment that we're seeing in patients who we're having to teach to do activities of daily living before they can go home. We're seeing implications for the heart and for the kidneys. So clearly, much greater need for patients, not just during the infectious phase of it, but also during the post-infectious phase. You know, at the peak, we were caring for over 350 COVID patients and had 6 intensive care units running at downtown Hopkins in Baltimore City. So while I appreciate that the numbers have come down, and from an inpatient perspective, we've kind of plateaued, I think one of the things that's concerning for us as we watch and project for what might lie ahead for us in a third surge, it's really the UK variant. The UK variant spreads twice as fast as the current COVID that we first experienced in this country. And so one of the concerns we have is what will happen during spring break, because 25% of all UK variant is in Florida. And so if there is a large spring break event in Florida, we're concerned about post spring break, what will happen as students come back to the States. So we are preparing to take care of the patients who need us if that begins to happen, as we have during the first and second phase. I would also state that while our positivity rate in the state has come down, it's down to an average daily 7-day average at about 3.85%. Dr. DeRosa will tell you we partnered a long time ago at the beginning of the pandemic around the 21224 zip code in the city. It's predominantly a Latinx population. At the beginning of the pandemic, we were greater than a 30% positivity rate. We partnered with Build and the Catholic Church and went in and actually set up a testing site. While we've continued to do that in that zip code, and as Mohan spoke to, we did stand up with the University of Maryland, the Lord Baltimore, to have an appropriate place for homeless, and also other vulnerable populations to appropriately quarantine. We've brought that down to where we're seeing about a 15 to 17% positivity rate in that zip code. It's still higher than the rest of the state, but it's come down significantly compared to where we began in the pandemic. We're not only providing testing there now, but we've also started, as Dr. Duraza will tell you, a vaccination site there in collaboration with Build and the Catholic Church. During the pandemic, since the beginning, we have delivered with multiple partnerships 5.7 million meals to families in East Baltimore, because we recognize that one of the most biggest needs was really the issues of access to food during this pandemic. I will also say that we've partnered with nursing homes, and we've stood up testing within nursing homes and also provided infection control, and continue to do that with 14 different nursing homes. We've also partnered with Dr. Duraza in doing testing sites for the homeless populations in our homeless shelter. I talked about the 21224 zip code that we are focused on. We've also started a project with Dr. Duraza, and we have been doing this in the District of Columbia. And that is, we take what we call our GO teams and actually go into senior housing units. I have personally vaccinated now in 4 different senior housing units. And it's clear to me that while all of these other mass vac sites and everything are important, we cannot forget the vulnerable population that are living in our senior housing units within the city. So we've partnered with Dr. Duraza, also the Baltimore City Housing Authority, and they have helped prioritize where they want our GO teams to go to be able to vaccinate people who could not make it to a mass vac site and could not make it to pharmacies or even primary care physicians. Many of them are wheelchair bound and have significant mobility issues. And like I said, having personally vaccinated these folks, they are very grateful for our presence. And thus far, 91% of all the people we are vaccinating through this method is actually African American. So it's also a mechanism for us to reach vulnerable population and also underrepresented minorities. I would also highlight that I agree with what Mohan said about the hesitancy factor, because the people that I have been vaccinating are not hesitant. They want to understand, and they also want to make sure that they are understanding from their peers what their experience is like. So peer-to-peer communication becomes incredibly important. We have also expanded our telemedicine to 24/7 for the patients we care for. We've done a lot of outreach and education with community stakeholders across the city, and will continue to do that. We have now vaccinated over 110,000 employees and community residents. We are now providing testing for symptomatic and asymptomatic testing. We are also providing asymptomatic testing using saliva. And so we will continue to do that at our testing sites. Last but not least, I would just like to recognize all of the folks who work at Hopkins and all the folks who work at the University of Maryland and our public health departments, because they are really heroes. They've really gone above and beyond to care for people with COVID. But I also worry about them because they have gone through many personal and professional stressors. And we've done a lot at Hopkins to try to support our workforce, everything from assuring PPE for their safety to providing food to our employees, to also setting up special funds for people who cannot pay their water bills, their electric bills, their rent. Also trying to provide bonuses at the holidays to support them, but clearly balancing what we need to do from a community perspective to get this pandemic under control, but also making sure we do it in an equitable way. And so I continue to thank Dr. Duraza for the partnership with the city and Dr. Santa for the partnership with the University of Maryland. It's been a pleasure to come together and try to serve the citizens of Baltimore City.
Thank you, President Sowers. Colleagues, I usually run a better ship time-wise, but obviously we've hit the 7 o'clock mark, but this is such an important subject matter that I do want to take an extra 10 minutes or so more just for questions from our colleagues, because we have these subject matter experts and for the listening audience to make sure that they fully understand what is going on from all of our partners here. At this moment, I just like to, before I open it up for questions, I also want to acknowledge that we've been joined by Senator Antonio Hayes from the 40th Legislative District and the Senator from the 46th Legislative District who likes to go as the 46th District Senator, Bill Ferguson. I'd like to open it up for questions at this moment. Senator Washington.
Thank you. And thank you, all of you. Again, Dr. Chan, I appreciate you. I look forward to us communicating more. I've always felt like you've been very thoughtful and have had a public health approach to things. But Dr. Zaraza and President Sowers, I also appreciate your approach. And I wish that we had that approach for our whole state from the top down, the way that you are very conscious about equity and delivery and understanding that the impact of the mobile units, that really is very, very striking. I think I wanted to ask both of you a question around, as we're going forward, because President Sowers, you talked about, this isn't the end. We have a whole public health program that we have to continue. So whether it's vaccinations or countering, risk assessing, I guess, looking at the delivery of vaccine and other services based on risk and not just age and things like that, risk of acquiring the infection, risk of severe morbidity, risk of societal impact, risk of transmission. How do those come into it looks like it's coming into your analysis. Can you tell me how we're doing that in the city, and also potentially, I guess, President Sowers, since you have a greater reach providing services to surrounding counties, how can we get the importance of looking at risk factors and not just, age or, whether you're a healthcare provider or whether you're a hospital worker, that there's a difference between being a teleworker versus being a frontline staff? Ideas, thoughts?
Dr. Draza, you want to start or you want me to start?
I think Dr. Draza can start. We'll start with the letter D.
Sounds good. I mean, so certainly as we were making the decision around our mobile vaccination teams, we considered a multitude of factors. So for those in particular, knowing that we had such a limited supply and we were going to focus on older adults, given what we know about the devastating impacts on older adults in particular, we looked at vaccination coverage rates in a particular zip code and the density of population for older adults. Other things that we've considered kind of once we move beyond the older adult phase is a social vulnerability index. And we can look at that again across the city to understand where there is a highest need. Again, we're fortunate to have partners in this space like Hopkins, like Maryland, who also, I would guess, and I might be putting words in their mouth, are also thinking about their catchment area, and they know their patients well. So, we're certainly providing them with data, but we're also working with them to understand, based on their catchment area, what is a social vulnerability index and how can we, again, target the resource to those in highest need, not just based on age, but based on other health factors.
Senator, I think one of the challenges, and I think Dr. Duraza would support this, that we've been faced with is every week we actually receive notification from the state as to how many vaccines we're going to get and what they would like for us to do with it in terms of distribution. And for us at Hopkins, it's literally by county. And I think one of the issues as you start thinking about stratification of the population is it was a supply versus demand issue. And the fact that we, even when we started this and used age as a category, there wasn't enough supply even to meet the age groups that were rolled out. And so now that we see more vaccine coming, I think we can ask the question. So for instance, every week in the last, I have to look to Dr. Chen, but I think in the last 3 to 4 weeks, we've received at Hopkins Medicine 400 vaccines for immunocompromised patients. And the reason that becomes important is as we've evolved in our understanding of the virus, we now know that the virus, when it infects someone who's immunocompromised, uses the body as a host for mutation. And so it's another part of how we've learned through the pandemic as to how we want to further stratify the population to make sure that we can slow down the mutation of the virus. I do believe that patients with comorbid conditions are more at risk. I've seen, as I've gone out to some of the mobile vaccine sites and delivered vaccine, that it's not just age that we have to think about. There are other factors. But I think at the beginning of the rollout of the vaccine, the biggest challenges we all had was this issue of supply versus demand. And I think that's why age was the first category that people selected because of the risk of the elderly.
Right. But I just wanted your perspectives on just out there, because we do have more vaccine, and we don't want to continue to see the disparities and the disparate impacts. And so we have to use these principles that you all are doing. And I think we could do that in statewide as well as throughout our city. But I'm glad you're working in our city to get the vaccines in the right arms. So thank you.
Yeah.
Thank you.
Thank you, Senator Washington. Any other questions from colleagues? Senator Hayes, are you trying to say something?
Yes, I'm sorry. I have multiple screens here, so I was trying to get my cursor over to the correct screen. So thank you, Mr. Chair. I appreciate it.
Yes, sir.
No, I think we're in a situation now, definitely, where the supply don't really meet the demand, but at some point in the very near future, I will predict we'll have a lot more supply, and we'll have existing those populations of people who may not be as receptive or motivated to get the vaccine. And so I wonder what that looked like. And the only other thing that I would say, especially as a Baltimore City legislator, it'll be really helpful, at least for me. We hear a little bit from the health department, but we hear a lot from MDH, but it would be helpful to get a better understanding of like the efforts in our various districts and actually partnership and some outreach. I participated in 2 this weekend, one with Walgreens and the other with the statewide task force. I participated in another one last week with the task force, but I'm not really sure or couldn't really tell you where like our local efforts are, at least as it pertains to my district. So I think that would be really helpful, but I'd love to hear, like, once we have a lot more supply and, people are hesitant about it, what does that strategy begin to look like?
Great, thank you for that, Senator Hayes. So we have really taken an approach where we have special populations, and we have designated special population leads. So that is inclusive of our Latinx community, our immigrant community, our African-American population. That includes our Jewish population. It includes those with intellectual disabilities and developmental disabilities. And so those leads are working with some of our partners, so Morgan State, International Vaccine Access Center, as well as MICA, to hold cross-city listening sessions. And those listening sessions help to inform our messaging. We've worked with the Mayor's Office of Neighborhoods to do canvassing in certain neighborhoods as well, making sure that they're aware of resources that are available. Additionally, we established an external task force, which includes partners across the city that help with dissemination of messaging. So that includes community-based organizations, faith-based organizations, our hospital partners, our federally qualified health centers, and they're helping with message dissemination. As a part of that, there's a subcommittee that is focused strictly on communication that does the same thing. How do we push our message far and wide using social media, but also using direct outreach to providers who can share that message within their community?
Yeah, I guess, Dr. Saraz, I didn't hear Coppin, and maybe it was a misstep. But
so
there's 2 major programs in that school. And
working with Hopkins, and I'm happy to say Hopkins has actually providing us with nursing students at our mass vaccination pod. So Coppin has been an amazing partner throughout this work. Notre Dame is providing pharmacy students. So I'll shout both of them out.
Fantastic. But if you would just continue to use us, as far as disseminating information we'll definitely try to be a partner in getting it out. It's just, I haven't, and maybe it's just me, I just haven't been getting a lot. But do the strategy look different when we have more than enough supply and we don't have people actually, come in to take advantage of the opportunity?
So I think at the city level, we'll always have mobile vaccination teams. There will always be a need for us to go to certain populations and bring them the vaccine. Again, we're starting with senior housing sites. Eventually that might be public housing sites. That may be, we're also now starting to look at homebound seniors as well, who live alone. But there's always going to be that need. I think as the supply opens up, then we're thinking about more kind of mass vaccination sites. Again, we've been fortunate in having so many partners that we can redistribute, and our partners have helped by hosting closed pods for city educators and our first responders. But yes, it does look a little bit different once there's more supply, but we'll always do the mobile teams.
Thank you, Senator Hayes. Dr. DeRosa, I guess my question is similar to his, and you explained it a little bit on the strategy. But so, President Sowers, this is directed to you. And you were here for the entire show. And Dr. Santa talked about 4 sites in West Baltimore where they've created these hubs. They're doing the lift. They're kind of making it for like the phone directory and things of that nature. They were very intentional when I listened to the sites. I heard New Shallow, I heard Mondawmin Mall, I think I heard BCCC, but the sites were very intentional. Just wanted to hear if something like that is going on over in East Baltimore. And I can connect with you offline, but I have been reached out to a number of seniors and some of the footprint that you all are right next to, and just looking to try to figure out if we can get some form of a viable solution going forward. But you already may have the efforts going on, and I may not know about it.
Yeah, Senator McCray, we actually do. I don't know if you know Dr. Sharita Golden, who's our Vice President of Diversity and Inclusion, and Jean Hitchcock have actively been looking at how we engage with the registration process in East Baltimore. And our first part was more outreach and education, and making sure people had access to that. But yes, we are in the process of working, and I can make those connections, Senator.
Perfect. I talked to Ms. Jean last night. I'm going to make sure I'm talking to her again tonight and on that specific subject. So thank you.
Mr. Chair.
Yes, sir.
A quick clarifying question. I apologize. Both the Senate President and I was in executive noms, and I missed Dr. Santa's presentation. But the 4 sites that he have in West Baltimore, which I represent most of it, did he provide the understanding that they're not actually getting vaccines? They're signing up?
Exactly. Yeah, he
Okay,
did that.
gotcha. Okay,
made that clear. But the signing of people up is very important.
Yes. Important too. Yes.
Of it. The information and kind of making that hub for information was equally as important. But Senator Hayes, what I heard was the sites themselves and how intentional they were. And I just wanted to make sure that we were doing something similar or on our way to doing something similar in East Baltimore too. So.
Absolutely. And Maryland has done an awesome job at reaching out to us and asking us and connecting us with sites as well. So no, they've done a fantastic job in it.
Got it. Seeing no further questions from my colleagues, I just would like to close tonight by just thanking Dr. Chan, Dr. DeRosa, President Sowers, Dr. Santa for joining us this evening to provide a status update on COVID-19. On behalf of the Baltimore City Senate delegation, just want to say thank you to all of the physicians, the healthcare providers for your hard work, your commitment during this pandemic. I can't say it enough, but we can't say it enough. Thank you, as you have risked your own health to serve our communities. We are indebted to you. The city of Baltimore and the state of Maryland will continue to monitor this virus, focus on available science to track its curve. I know that the work of our health professionals goes beyond the numbers and involves treatment and development of solutions to end this crisis. We want to thank each and every one of you to know that you have been a partner and each of us as you conduct this most important work that we have in front of us. If there's anything that you think that we may be able to do to support this work, please do not hesitate to reach out to us. Once again, just want to say to the listening audience, thank you for joining us and have a blessed night. Thank you, colleagues.
Thank you.
Thank you.